Before you start taking budesonide, make sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily in the morning at least 1 hour before a meal. Swallow the whole capsule with a full glass of water, unless your doctor tells you otherwise. Avoid eating grapefruit or drinking grapefruit juice while using this medication, as it can increase the chance of side effects. If you are regularly taking a different corticosteroid by mouth, do not stop taking it unless directed by your doctor. Use this medication regularly to get the most benefit from it, and take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. Do not stop taking this medication without consulting your doctor. Tell your doctor if your condition does not get better or if it gets worse. Budesonide 4 mg capsule. Delayed release usually has fewer side effects than other corticosteroids because it works in the gut and only small amounts are absorbed into the body. Some side effects may include acne, muscle spasms, or swelling in the hands, ankles, or feet. If any of these effects persist or worsen, consult your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risk of side effects. Many people who use this medication do not experience serious side effects. Since this drug weakens the immune system, it may lower your ability to fight infections. This could make you more susceptible to serious, and rarely fatal, infections or worsen any existing infection. Contact your doctor immediately if you notice any signs of infection, such as a persistent sore throat, fever, chills, or a cough. In some cases, this medication may cause oral thrush or a new yeast infection. If you notice white patches in your mouth, a change in vaginal discharge, or any new symptoms, be sure to contact your doctor. If you experience any serious side effects, such as easy bruising or bleeding, a puffy face, unusual weight gain, changes in menstrual periods, mood changes, weakness, bone pain, thinning skin, slow wound healing, increased thirst or urination, or vision problems, talk to your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as a rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. Before taking budesonide, talk to your doctor or pharmacist if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist, especially if you have eye problems, high blood pressure, liver problems, diabetes, stomach/intestinal problems, bone loss, infections, bleeding problems, or mental/mood problems. Using this medication for a long time can make it more difficult for your body to respond to physical stress. If you are going to have surgery or emergency treatment, or if you get a serious illness or injury, make sure to tell your doctor or dentist that you are using this medication. It's also important to let your doctor know if you develop unusual tiredness or weight loss. If you plan to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Using alcohol while taking this medication may increase your risk for stomach bleeding, so it's best to limit alcoholic beverages. This medication can also make you more likely to get infections, so try to stay away from anyone who has an infection that may easily spread. It's important to talk to your doctor if you have been exposed to an infection. Before getting any immunizations or vaccinations, let your healthcare professional know that you are using budesonide. It's important to avoid contact with people who have recently received live vaccines. If you are an older adult, you may be more sensitive to the side effects of this drug. This medication may also slow down a child's growth if used for a long time, so it's important to consult the doctor or pharmacist for more details. During pregnancy, this medication should only be used when clearly needed, and you should discuss the risks and benefits with your doctor. If you are breastfeeding, it's important to consult your doctor before using this medication. Drug interactions can affect how this medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Make sure to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this medication are aldesleukin, mifepristone, and drugs that can cause bleeding or bruising. If your doctor has prescribed low-dose aspirin for heart attack or stroke prevention, continue taking it unless your doctor instructs you otherwise. This medication may interfere with certain lab tests, so make sure to inform lab personnel and all your doctors that you are taking this drug. If someone takes too much budesonide 4 mg capsule delayed release and experiences severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can contact your local poison control center at 1-800-222-1222, while residents of Canada can reach out to a provincial poison control center. It's important not to share this medication with others. If you're using this medication for an extended period of time, your doctor may want to conduct lab and/or medical tests, such as blood count, bone density, eye exams, and height/weight measurements. Make sure to attend all of your medical and lab appointments. You should also consult your doctor for more details. Using this medication for a long time may increase the risk of bone loss, osteoporosis. To promote healthy bones, consider making lifestyle changes like increasing weight-bearing exercise, quitting smoking, limiting alcohol consumption, and eating well-balanced meals that contain adequate calcium and vitamin D. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the one you missed and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store budesonide 4 mg capsule delayed release at room temperature, away from light and moisture. Be sure to keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.